Another side effect of erdafitinib that's fairly common are nail changes. This is referred to as onycholysis and also paronychia. And so these can oftentimes be at least prevented somewhat by using sort of proper hygiene, trimming the nails carefully, using gloves when needed for protection of the nails. And then if onycholysis or those types of symptoms start up, especially for early grade or low grade toxicities, one can use nail lacquers and protectants to try to treat them. I would say that getting a dermatology referral early is always a good idea for counseling for sort of dry skin and nail changes that do occur with this drug. A third toxicity that we need to look out for are actually ocular toxicities. About 1 in 5 patients on the BLC 2001 trial had what we call central serous retinopathy, which is also a class effect of these drugs. So what we usually recommend is that patients have a baseline eye exam done by an ophthalmologist, and then of course to be followed by them routinely and to be seen by them if they do develop any symptoms. And then actually the medical oncologist or the staff can actually do what's called an Amsler grid test every time the patient comes in for evaluation. And it's very easy to do in the office, basically just looking at a 10 by 10 grid and having the patient describe any changes on that grid that are concerning for blind spots or warped areas in the visual field. And those are usually early symptoms that the patient may be developing some subretinal fluid or central serous retinopathy. And in that situation, they should halt erdafitinib right away and be seen by an ophthalmologist as soon as possible. And then the last side effect that can occur fairly frequently is mucositis. And so taking, for example, salt and bicarbonate mouthwashes maybe 2 to 3 times a day, even before those symptoms occur, is a good idea to try to prevent them. If they do occur, I would say starting dexamethasone mouth rinses early can oftentimes alleviate those symptoms pretty quickly.